Hi, my name is Marisa Consalvo. I am a junior Colby Sawyer nursing student, and I am applying for the nurse externship this summer in the intensive care nursery. I first want to take the time to thank you for taking the time out of your busy schedules to watch this video. I first want to tell you about one example of how I used the nursing process in my clinical experience when I cared for an anxious and combative man who had been recently diagnosed with cancer. The nurse and I went in and needed to assess the situation, and unfortunately, the patient's anxiousness and agitation put him in danger as well as the nurses and other staff members, which led us to putting him in wrist restraints. However, as the morning progressed, I was able to sit down and talk with the patient, and I learned much more detail about his life and what was going on with him. I learned that him and his wife were best friends and have been married for over 50 years, and it was at that point in the morning where she wasn't able to come in and he was alone and the anxiety was really getting to him. I continued that morning to perform 30-minute safety checks and continue to be present for the patient when his wife wasn't there. Later that morning, after speaking and talking with him, we were able to take the wrist restraints off, and his wife ended up making it in. And I really learned to look at this experience holistically. And the wife also was having a very difficult time adjusting to the thought of losing her husband soon with the cancer diagnosis and treating the anxiety and emotional piece, and seeing that in nursing process you have to look at the patient, but you also have to look at the family and the significant others who are also being affected by a new diagnosis, and caring and educating them both. I next want to tell you about an event that's very personal to me that didn't go the way I expected, and how I adapted to that situation. Ever since I was little, we have opened our family up to foster children, and we had fostered a little boy for about 2 years, and in hopes of adopting him and him becoming a part of our family. Throughout the 2 years, I had learned to love this boy like my brother, and unfortunately, when we did go to court, we didn't win the custody battle. He did end up going to his grandfather, and at that time, that was completely unexpected for me. I thought we would be taking him home, and I would be able to spend the rest of the night and my life getting to know this boy, and unfortunately, that wasn't the case. But later, as I developed this and learned that, however, he didn't get to spend the rest of his life with us, he was with his family and able to spend time with his grandfather, and that was really the best for him. But in the end, this experience made me so much stronger, and I have brought this into my nursing practice, and taking a day in the ICN, as well as my experience in the birthing pavilion throughout the semester. There are experiences where I don't feel 110% comfortable of letting these children go home with the families, but the best I can do is give them the care that I can while they're with me, and give the parents the best education I can and let them go. Lastly, I want to give you an example of when I was able to successfully communicate with another person with a different communication or style from me. This past January, I was able to gain experience in Costa Rica during a medical mission with other fellow Colby Sawyer nursing students, and immersed in a different country and a different language with different doctors and healthcare systems. It was very difficult to imply our healthcare practices as well as educate these patients on the rights and what they should be doing to help their health. And I learned when in the daycares working with children that being there and showing them, and not just pen and paper, this is what you should be doing, and giving discharge paperwork. It's really being immersed and showing the children how to brush their teeth, and even though they don't speak the language, but we were able to still show the children how and what to do and give them the love and care. And I have never seen so many smiles before, and it was honestly a life-changing experience. I want to thank you again for taking the time to watch this video, and I look forward to hearing from you soon.